With the Philippines moving up the ranks in the region, what is the assessment of international health experts of our situation? Let's find out from World Health Organization representative to the Philippines, Dr. Rabindra Abeyasinghe. Thank you so much for joining us, Dr. Rabi, on The Final Word. First of all, the Philippines now has the highest number of COVID-19 cases in Southeast Asia, surpassing Indonesia. Are you concerned?
Good evening, Rico, and good to be here. Yes, we are concerned. We are concerned with the large number of cases, and we are concerned that the Philippines is reporting the highest number of cases. But I don't think we should be comparing countries. It is a matter for concern, but what's really concerning to us is the continuing increasing trend seen predominantly in the NCR and the adjoining regions of Region 3 and 4A. And what continues to be worrisome is that this increasing number of positives is being reported continuously with an increase in testing capacity, which shows that there is significant levels of transmission in the community. And so there is a decision of the government to reimpose MECQ, or a modified enhanced community quarantine, is a good measure which will help to arrest the ongoing transmission to some extent by reducing the mobility of people. We believe that when we look at the cases in the Philippines, we see that a large proportion of those are among 20 to 40-year-olds, who are the active population. And this is similar to an increase of trend we've seen in many other countries that have relaxed their quarantine measures. In these situations, it is imperative that we do everything to reduce the mobility of those people responsible for transmission.
So, Dr. Rabi, a couple of weeks ago, you were quoted as saying that the government has to expedite its tracing, treating, and isolating and testing on a much faster scale. Have you seen any improvement over the past couple of weeks on this?
Yeah, so we are seeing improvements. There are many things that are being implemented as I speak. We are seeing a gradual reduction in the time required from testing to the release of reports. We are urging for that information to be shared with the local officials so that they in turn can share that information with the public, so that the public knows where is the transmission happening, and so that early contact tracing can be carried out and identification of positives and close contacts can be done early, and they can be isolated and quarantined so that other people are not affected. This is important to suppress the ongoing transmission. At the same time, it's also important that the government increases healthcare capacities, because we are seeing increasing numbers of admissions into the hospitals.
A vaccine, Dr. Rabi, is the key to fighting this unseen enemy. The WHO has conducted solidarity trials. Which phase are you in right now in the Philippines, and which trial vaccines are being used?
So we are not doing any vaccine trials in the Philippines. There are actually 165 candidate vaccines that are being tested at this point of time. 21 of those are now in human trials, and four of those vaccines are now already in phase 3 clinical trials, meaning that they are being administered to large groups of people, up to thousands of people, to test their efficacy and safety. However, phase 3 trials does not mean that they are absolutely safe, because they may not capture rare side effects that could occur 1 in a million or so. So we are still looking at the vaccine with optimistic caution. We believe that the accelerated time frame is very optimistic, However, we, as our Director General has said, we should not put too much hope on the vaccine, because we know that by doing the current practices that we advocate, we can suppress transmission.
All right.
And I believe that for the moment, that is more important, that we stay focused while we wait with optimism for a possible vaccine, a safe and effective vaccine being developed, but that's still in the pipeline. So I think the focus now should be on each one of us practicing the physical distancing, the cough etiquette, the frequent hand hygiene, so that we break the transmission. And if and when we have a vaccine, that could be an additional tool.
And briefly, Dr. Rabi, the WHO has also done its research that this pandemic is now moving into younger populations. What more can you tell us about this?
Yes, so we looking at the data that has come out since the end of February till mid-July, we are clearly seeing a very significant increase of proportion of infections in the younger age groups. So in the age groups under 5 up to 15 and indeed up to 29 years, in those age groups, we are seeing significant increases in the proportion of positives we are seeing. We recognize that these people are not entirely risk-free. We have seen significant complications in this group. We have seen deaths among these groups, even in the Philippines. And so it's still imperative that we do everything possible to protect these people and to protect onward transmission from them.
Thank you so much for joining us on The Final Word. WHO's representative to the Philippines, Dr. Rabindra Abeyasinghe.